Another common question that I see is, or get asked, is someone is interested in improving the appearance of their stomach. What procedure is best for them? So essentially what you're dealing with is the difference between who is a candidate for a tummy tuck and who is a candidate for liposuction. And it mainly depends on the quality of the skin, but there are other things. So essentially what are we looking at here? Skin on the outside, layer of fat, muscle, and then your intestines. If you are a young, healthy person, maybe just a little overweight, just a little extra fat, most likely you're a good candidate for a liposuction because you may not have excessive fat inside of you pushing out, which causes the abdomen to protrude. If you haven't had children and your muscles have not been stretched, your abdominal muscles will still have a good shape. And you probably haven't had significant stretching of the skin, which would yield stretch marks. So when you liposuction, you're essentially deflating by removing fat, and you liposuction to what you think is a reasonable point, which means you've either corrected the problem or you've reached the point where you begin to see very fine wrinkling of the skin. The main negative of liposuction, or when liposuction is done, I don't like to say the wrong way, but the error in liposuction that a surgeon will make is removing too much fat. You have to have a layer of fat between the skin and the muscle to cushion it, to let it lay smooth, and most importantly, to not allow the skin to adhere to the muscles. Let's say you've had children, your abdominal muscles are stretched, you have stretch marks on your skin from that, or nowadays we have a lot of patients who have had gastric bypass and have lost a tremendous amount of weight. Once the skin is loose, liposuction is really not the best treatment. So what an abdominoplasty or tummy tuck will do is tighten muscles, which could be stretched from pregnancy or weight gain, and then pull down and get rid of the loose skin that is excess. The fat at that time is really not removed because liposuctioning aggressively during a tummy tuck can lead to problems healing. So mostly determined by what the skin quality is, among other things.